All right, so you are the lung cancer key opinion leader. You've dedicated your life to this. How many years did you say you've been coming to ASCO now?
It's my 39th year. I was a
Pretty
babe,
remarkable.
a little kid.
Yeah, well.
But to see it evolve, it's very exciting, and lung cancer is an example of incremental. Each year we see something that really gives us hope that this is someday going to be a universally curable disease.
Well, years back, I was looking through the abstract book and the program. You would never have seen this much information before on lung cancer. It's really remarkable, pages and pages. So I know that you have about 4 areas that you're going to discuss with us,
okay.
And it's yours.
Well, so the biggest issue, of course, is to try and prevent lung cancer. And so there's a number of papers that are out there that are talking about smoking and as a worldwide issue in methodology that can be used for the physician, the cancer specialist, to talk to their patients about stopping smoking, and particularly the people around them to take the opportunity of a cancer diagnosis to stop smoking. And you can't blame the victim. You smoked, it's your own fault. That's not the issue. The issue is, A, you should stop smoking, and B, let this be an object lesson for the people around you that unfortunately there could be some predisposition of your family members, your environment, that could be additive. So there's no major breakthrough in terms of smoking cessation other than to continue to raise awareness and put it out there as an issue.
I'm so concerned about now the concept of putting the nicotine, is it gum they're making?
The nicotine isn't the bad thing. It's the other things that are in tobacco, the carcinogens. But the nicotine is the addicting and profoundly addicting. So this is one area one way we can prevent lung cancer. The other area was a hypothetical one, a very interesting story about selenium. This is a long-standing study that was built on a rationale that there's some very interesting epidemiologic issues. Certain regions that are high in selenium are lower in various kinds of cancer. And it was a profound hypothesis that was tested in a large clinical trial chaired by Dr. Dan Karp as part of ECOG, and it started in the year 2000, and just now is reported out, because you're looking at long-term outcomes of incidence of lung cancer was the primary endpoint. Unfortunately, in a randomized study of selenium versus placebo, no difference. Not only the hope was for reduction of cancer, of lung cancer incidence, but also some of the other cancers. And unfortunately, the hypothesis did not prove. So we really have no way of preventing lung cancer other than the very central message of smoking: don't initiate and stop. And these are it's just such a tragedy to see the high incidence, particularly in developing countries, particularly in populations in our country, in the U.S., minority populations, where smoking incidence, unfortunately, is very high. One of the themes is that lung cancer is not one disease, and we now have a variety of biologic evidence that there is a clear type of lung cancer associated with never smokers. It's an important difference between, do you smoke? No, I don't smoke. Well, did you ever smoke? Oh yeah, when was the last time you smoked? Well, when I was waiting in the waiting room. That's not the question. The question we want to know to is, did you ever smoke? Or are you a never smoker? And so there is, unfortunately, a subtype of lung cancer that is associated with non-smoking, and that probably has a somewhat different biology.
So when you take that tissue sample and you look at it and study the pathology, are you able to learn anything yet about the biology of these two types of cancers?
Yet, a little bit. It's incremental, again. The issue is, example, with the use of drugs that are now available, the so-called epidermal growth factor receptor inhibitors. The one that's most commonly used is Arisa or Tarceva, and there is evidence, and also for similar drugs to like gefitinib, that these drugs are probably more effective in never smokers and that has to do with the type of mutation at the epidermal growth factor receptor. So that has to have just the right configuration, and if it's mutated, if it's changed, then it's more likely to cause a cancer. More likely to cause a cancer in a never smoker, and more likely to be treatable with inhibitor of this particular EGFR receptor.
Every physician I've had the privilege of speaking with here at ASCO, we come back to the same thing about the issue of tissue and the importance of really molecular pathology.
Right.
And I keep saying, we have this interdisciplinary medical team, but the one doctor that we rarely talk about who has such a pivotal role right now is, to me, the pathologist.
Absolutely.
And molecular pathology is to me, it's one of the most exciting areas, because when you understand and you can, genotype your specimen and to me, that's the root of how you're going to develop and choose your targeted therapy.
But there's got to be a reality check. This is complicated, and tissue banking and the preparation is highly complicated. It's been a big public discussion about the testing of HER2/neu, and it varies for breast cancer. There's a wonderful, of all places, in Wired magazine about the technology of tumor banking and how complicated it really is. And so this is high technology, not simple. It's going to be very resource intensive, but we only have one goal in mind as we sit here today, and that's to cure cancer.